Here we go.
Right. Yeah.
Hello.
Hello. Hello, Karen.
How are you?
I'm very well, thank you.
Good, good.
Yeah.
So, thank you for joining me. I'm going to call you Boji. I know it's Dr. Saad. Is that how you pronounce it?
Saad.
Saad. Saad.
Saad.
Saad.
With a double A.
With a double A. So, Dr. Saad Boji, who is, I would say you are a dentist extraordinaire.
Thank you.
Well, I would, honestly. My biggest fear has always been dentists because of the experiences I had over the years as a child. Horrendous. And I don't know if you are familiar, because I'm a little bit older than you, but in my day, they seemed to encourage a lot of dentists from South Africa, Australia, and I think Greece. One of my dentists told me Greece. They would come over to England and do a lot of work on children in particular, I guess, and adults, but I was a child at the time. And they would be paid to, the more fillings they gave you, the more money they got. And I think, so I was a victim of that, and many of my, you know, my friends the same age were victims. And I know teeth were filled that weren't needed to be filled and what have you. And I've had horrendous experiences with dentists. I used to call them butchers in my day. And then when I came to you, we said it was a year ago, because of the gum disease and a recession. And I thought I tried everything. I eat well, I exercise well, I look after myself, I don't drink alcohol. You know, I really try to do everything possible to look after my gums and my teeth. But lo and behold, maybe it was stress, or maybe it was, I mean, can it be through, you know, my, what's the word, gosh, when it passes down the family?
Genetics.
Yes, genetic. That's I was going to say another word. Genetics. I was going to say gen is something else.
The genes.
The genes.
Hereditary genes. Yeah.
So could it be that?
It is. Gum disease is a multifactorial disease. It's not only like coming from genes only, or this is like you inherited from your parents or grandparents or so far. It's multifactorial. It's the environment inside the mouth, I mean the bacteria, if there is any good environment for the bacteria to enhance really the gum disease and cause this gum disease, or make it more advanced, make it more worse, and so far. So, and also the genes, if there is something going in the family as well, and also the brushing techniques, the way you brush, you will floss, you will take care of your oral hygiene. But there are, you would say, like there are so many people so many people don't brush their teeth properly, and don't look after their teeth like you do always.
Well,
and they have much better condition of the gum. So about 17 to 25 of the population after the age of 40, they could have like a gum disease problem. We call it periodontal.
Right. And
it's the tissue around the tooth structure.
So and the tooth get wobbly.
Yes, sometimes get wobbly due to the mobility, due to the excessive bone loss and ligament loss around the tooth, and this ending up with the tooth that it will be mobile.
Right.
There are 3 grades of mobility: grade 1, grade 2, grade 3. Grade 3 is really very mobile tooth. Grade 1 to 2, we can really try our best to save the teeth. Especially grade 1, we have really much better prognosis than grade 2 to 3. So grade 1 to 2 is much better. But still, it's not only the mobility, it's the inflammation of the gum, it's the infection, we call it periodontal disease, and it is chronic inflammatory disease of the surrounding tissue of the tooth, which are composed of the periodontal ligaments, like elastic fibers, which join the tooth with the bone and the gum.
Right, so it's like the glue that secures the tooth together.
Secure the tooth into the socket.
So when I came to you last November, I was crying because of I was absolutely crying, and partly because of the fear of sitting in these chairs, the memory, the trauma of it is a massive thing for many people, not just me. And now I've come in, I'm a bit flushed because you've just given me some laser treatment and you have turned my gums around, which has been absolutely
luckily
phenomenal.
We started last year, and about in March last year to November, in March, April, we have really achieved a huge beautiful results and spectacular results of the gum disease treatment with the aid of laser treatment.
With the aid of laser. So can I just ask a little bit about you? Where are you actually from? What's your background?
My background is from Baghdad originally. I am about half Iraqi, half Greek.
Yeah.
I went to Greece in older age, about 26, 27 years old. I joined my second country, and I lived there about 23 years, and I came to England just last 5 years. I have been in England with my family,
with your family,
my wife and my 2 daughters.
And you were practicing dentistry in Greece and Iraq?
Yes, I did practice in Iraq dentistry for about 5 to 6 years.
Yeah.
And then 1996 I left Iraq and went to Greece, and I practiced in dentistry there since 1996 till about 2019 when we moved here to England.
Lovely.
Okay, and I was practicing the laser treatment, periodontal disease, gum disease treatment. I was practicing the laser application. I was applying the laser treatment for gum disease since 2004.
So 20 years.
Yeah.
Because when I came to you last year through another dentist, when she and this was a holistic dentist, because also how we look after our teeth is how we look after ourselves, isn't it? And the importance of teeth that is linked to gut disease. It is a gate, and people don't realise.
It's our health in general.
It is so important. And when she said, your colleague, she sent me here, and I was so excited because of the word laser. Because I know this is the alternative way. I had my eyes lasered about 10, 11 years ago as well, when the optician said, oh, when you get old, the muscles in your eyes deteriorate, so you have to wear glasses. And I went along with that for many years, and then somebody said, oh no, you can get your eyes lasered. And I had 11 years ago, and now I don't need glasses. So when your colleague said, go and see Boji for the laser treatment for the teeth, I just was so excited. And so tell us about it, because when you did this 20 years ago, people sort of poo-pooed you. They thought, oh, don't be silly, didn't they? So you're a hero.
So I had a lot of courses about laser, and it was really, 2004 was really very, very at the beginning of the whole, this technology, this innovation.
Yeah.
And it seems to be, it's really, really highly developed in the last 10 years to the peak of its results and peak of its achievement. So I started to be with the laser, dealing with the laser since 2004. I have done so many seminars, webinars, and so many courses of laser treatment in Austria, in Athens as well. And that gave me really the principles of using the laser in treatment of gum disease treatment, in hard tissue laser. We use it for fillings, we use it for bone regeneration, as I have done this with hundreds and hundreds of patients. Also, the soft tissue laser could be very helpful, and the hard tissue laser, using them both in combination to help the bone regeneration around the teeth and to create a new periodontal ligaments and gum tissue bag from as a natural healing of the wound around the teeth and of the gum disease, and pocketing, diminishing the pocketing around the teeth with the laser. So usually the treatment with you, Karen, it was about 4 to 5 sessions. We were using a combination of hard tissue laser and soft tissue laser. Internally inside the box we were using mainly the thyroid laser, which is soft tissue laser, and we were using as well the erbium laser, which is for hard tissue laser for externally around the gum and around the tooth, as well as the gum around the tooth, and helping the tissue to be healed properly and regenerate properly. So the main mystery and the main secret with the laser, it is the main tool which will help after having the treatment of gum disease, which will help to stimulate the tissue regeneration, whether they are gum, whether they are periodontal ligaments, whether they are a bone tissue, stimulate the tissue regeneration back, not to the extent when we were 20 or 30, but stabilizing the tooth with this treatment is a very, very high achievement after we had really, in your case, Karen, unfortunately, very deep pockets, over 7 and 8 millimeters, and we managed within 4 months to 5 months to diminish them and reduce them to 2 to 3 millimeter pockets. So this is a big achievement, and the mobility of the teeth stopped, and the color of the gum is pink in color, and there is no mobility of the teeth.
And you're saying bone is regenerating as well?
The bone was regenerating and did regenerate already, and the periodontal ligament did regenerate already, and our pockets have been diminished.
Yeah,
almost
amazing.
Completely. So achieving from 7 to 8 millimeter pocket and reducing it to 2 to 3 millimeter, it is the normal sulcus depth and pocket depth. It's the healthy depth of any tissue around a tooth.
Right.
Also, it did help of regenerate the gums, so you had severe recession in so many teeth, and this recession being really reduced about, let's say, a recession of about 5 millimeter or 6 millimeter being reduced to 3 to 4 millimeter. So we gain a new tissue, gum tissue, with the bone tissue, another 2 millimeter, 3 millimeters, which is a big achievement.
It's incredible
results.
And I would say also, being the patient that sits in this chair behind us, who is so terrified of it. Now I'm not. Today when I saw you, I thought, I'm just going to see Boji, I'm just going to go to the dentist. Partly because I know what you're doing is just so beneficial, and you saved my teeth and my gums are regenerating. And I think what it is, it's also a thing about self-confidence, because, you know, it's the, like you said, it's the entrance, isn't it? When you see somebody and they smile, it says a lot about that person. Exactly. And if you think you are going to lose teeth or whatever's going on in that mouth, the fact that you are giving them a new lease of life is just so empowering for a person. And I know a lot of people are now starting to come to you.
Thank you.
Well,
thank you.
Thank you.
I appreciate this really.
No, not at all.
We had a presentation in your last festival, the one before as well in May, and that was really incredibly fantastic one. So many patients came back here.
But I think it's also
so many patients coming from so far away.
They're hearing about it later on. Because I think also this is why I really wanted to chat with you, because it is holistic, isn't it? And it is kind of alternative. And
there are so many other applications of laser inside the dentistry, like when we have an infection, severe infection underneath the tooth, and the tooth is not restorable, so we can extract the tooth and apply laser, hard tissue laser, or soft tissue laser, whatever, to disinfect the socket and to stimulate the bone regeneration into the socket, and within 2 to 3 months this site will be ready to insert an implant. Without doing the laser after the extraction, it might lead to more bone loss and more severe dissolvement of the bone and less bone available to insert an implant. Ceramic implants, I do insert ceramic implants, which is holistic way as well. I do insert as well ceramic coated implant, it's a titanium implant, but they are ceramic coated implants. I do use 2 types of ceramic implants. One is full ceramic, the other one is a very small amount of titanium inside, which is not coming into in contact with any tissue or bone at all. So the leach of titanium ions that so many holistic patients are worried about from the titanium implants, in this case is not happening in the implants, which are really adjusted and being developed for holistic patients who are seeking no titanium leaching or no titanium ions leaching outside of the implant to the bone tissue.
So it's all safe.
It is absolutely safe. There are so many research about it, and the ceramic or the zirconia implants and the ceramic implants or the ceramic layer even, they are the most biocompatible layer of material, the most biocompatible materials which come in contact with soft tissue or hard tissue. And even the zirconium crowns and the bridges we do always now over the natural teeth and over implants, we do only zirconium crowns and bridges because they are the most compatible material. It is we call it in between 2 brackets, we call it like the technical diamond.
The diamond in brackets. Or brackets.
Also bone regeneration using the laser without using bone grafts or something like this. It's really being very helpful. I have a big research about this use and this pioneer use of the laser for bone regeneration in gum disease, and also after the extraction of very infected, highly infected teeth, to eliminate the infection completely and regenerate the bone with a very natural, healthy way without using a huge amount of like cadaver bone grafts or a huge amount of animal bone grafts. I'm not using any type of those
you're
bone grafts,
yeah.
because I'm using only synthetic bone grafts or auto bone grafts, which I can select it and collect it from the patient himself, from his jaw bones and somewhere else near the tooth as well, to have some auto bone grafts if needed.
If needed, okay.
After like doing the extraction with the laser aid, with the aid of the laser disinfection.
And how did you actually get into it? Because I know when I first came to see you, because I haven't come across a laser dentist before. So you did this 20 years ago, and you were, as I was saying, a lot of your colleagues weren't very supportive of you at the time, were they?
Yes, yes. At the beginning, really, we had a chat of so many dentists in Greece when I was there, and I had so many chat about the use of laser in dentistry in general, either with the gum disease treatment, either with hard tissue laser like having fillings, or bone regeneration, of disinfection of the sockets, or removing of big cysts and big infections and big lesions, or small lesions underneath the teeth or surrounding the teeth. They were just laughing with me, and they were just saying that that's impossible, you can't achieve something like this. And here we go, I have so many cases to show them. Since 2015 and 17, I had so many cases to show that my colleagues in seminars and webinars and also in conferences, and they were really shocked about the achievement I had with the laser machine. Because we can say that really very little dentists, unfortunately, using this machine. It's cost effective, it's really need a very good knowledge about it, very good training about it. So this is really very highly cost effective. So maybe this is one of the reasons, but this is, I was always trying to achieve the best, the last word of dentistry in my life, and that's what I'm doing here and continue to do it.
Well, I think that's what I love about you, because you genuinely care about the person. I know it's not a cheap way to get your teeth sorted, but as we said, teeth are so important, because they are the gateway to your health, and they are linked to gut and gut disease, and there's a lot of research.
We are what we eat and chew.
What we eat and chew.
This is very important.
We are what we eat.
Because if we don't chew our food properly, this will cause a lot of problems, gut problems, and we need to be careful about the probiotic enhancement of our health. They are helping a lot in so many diseases like gum disease treatment and gingival infections and periodontal infections. This chronic infections needs to be really very healthy, what we eat, very like so many stuff. I'm not gonna go through this one, it's not my specialty, unfortunately, but I would like really, I'll try my best in the soon future, sooner not later, to have some more like license and some more education about the biodentistry in general, as already I am offering here the removal of the amalgam fillings.
That's what I was going to come to. So just
under a special protocol, which is
tell us before we do it. Tell us a little bit about the amalgam, because that's, again, as a child, it's filled us with it.
Yes,
so what's
that's
not
unfortunately that was the like material of choice at that time.
Because it was cheap. Or?
No, it was like it's solid, hard, and could stay many years inside the tooth. And but they were not aware about a real like side effect or real danger behind this material.
And what is it? Is it the mercury that's in it? Or?
The mercury in it, this is the most really poisonous material. Even when we chew our food over an amalgam filling, with this friction we might deliberate a lot of mercury, or even those small amounts of mercury. They are really poisonous material, and it's not the best of our general health. I wouldn't say that. I would say that you will heal if you remove your amalgam fillings. I'm not allowed to. This is not my specialty again. But I would say, according to the literatures, that the friction of the amalgam fillings and the chewing over the amalgam fillings could really liberate a lot of amount of mercury, and this is going and being absorbed by our body.
So it's best to
remove them,
and not go to any old dentist.
Best to remove them under a specific protocol with a huge precaution for patient protection and dentist protection and staff protection. and a special suction, special air purifier, special insulation and isolation of the tooth, and a special air breathing, like medical air breathing, a special cannula, putting in the nose and covering the face, covering the eyes, covering everything, covering the body. So for any potential mercury, hazard of mercury or vapor of mercury coming out to the body.
I mean, I had mine removed many years ago, but they just kind of took them out.
Yeah.
There was none of this really protecting the patient and the people, you know.
This protocol is being applied just the last 5 years to 6 years mainly. So this was really like revolutionary application and protocol, and they really helped a lot of people to start to remove their organ fillings with more safety rather than without applying this protocol.
Can I also ask you, Boji, the question which you might just want to wipe over? Fluoride. Okay, so every dentist I've ever been to, and I know I don't want to rock the boat here because of your profession, but every dentist I've ever been to, fluoride, and they said when I used to go back,
this is what we've been taught many years ago, and they continue to teach students about it.
To use it.
Yes, it is good, but the harm it could cause, according to the new literatures, very new literatures, the last 4 to 5 years again, it is really bigger than the advantage to it. Fluoridation of the children's teeth, you would ask me, is it good? Using the fluoride inside the toothpaste, is it good? Fluoride, according to so many literatures, like the mercury, like the fluoride and chloride, they are unfortunately neurotoxic.
Yes.
Okay, and I am not saying this by myself. There are so many literatures.
Yes.
In PubMeds you can find it. Fluoride and chloride, they are both a neurotoxic material. So this accumulation of using the fluoride every day in our toothpaste, it might be really harmful for our nervous system.
Would you suggest then not to have fluoride in your
I would
toothpaste?
suggest, but with the precautions, because I wouldn't have, I don't need to have the revolution by myself. But if you'll ask me, and for my holistic patients specifically, or for any patients, fluoride is delaying the gum healing. Fluoride could help a little bit for the tooth decay, but this, when the tooth is erupted inside the mouth, any amount of fluoride will not really be helpful.
No.
Yeah, so using it in children, it is good for prevention of decay, but not systematically, just topically, maybe. With the precaution I'm saying that, but still there are so many literatures coming out on the surface which giving us more and more information about the hazard and the harm that could be caused by fluoride themselves.
And they are putting it in the water, aren't they?
Yeah, it is in the water.
Well, we'll leave that one there because I don't want to. Because I know you're a very professional man, and we don't want to upset the boat.
Exactly, and it's really. I think using or not using the fluoride, it's responsibility of each one of us to Google it, to search about it. That will be really more beneficial. Yes, do your research, guys.
And maybe
do your research about laser. Do your research about bone regeneration with laser. Do research about disinfection with laser. How it is really. I will be very happy to discuss with you anything you need to be discussed, and everything about laser. You can visit me here in my practice in Hove. It's a Boundary Implant Center, and I will add to this session my email and
I'll put that
practice
in the
and the address of the prescription. And I am more than happy to be seeing you guys here in my practice. With a pleasure, I will explain everything about laser treatment and about bone regeneration and about even fluoride. If you would like to discuss this with me, I will give you the pros and cons of using it or not using it. With a pleasure.
Thank you.
Also, I will offer now for the next 2 months after this video a complimentary consultation about laser, about implants, about ceramic implants, for all holistic patients who are interested of ceramic implants. And even I am using titanium implants the last about 22 years and more, and they are really highly successful in some conditions. That doesn't mean they are not good implants. They are beautiful implants, nice implants, successful implants, and we can insert them in any patients, even though holistic patients, if they would like to. I will explain the pros and cons of each implants type.
Thank you.
Thank you very much, Karen.
Can you do this, if people are watching this and they are interested, can you do it just by telephone? Because we might have people watching this.
Yes, we might have some like information, like some X-rays if they have with them, and they send me over the email of the practice. They send me the X-rays. They send, I can do like definitely.
Because some people I know
they are living very far away.
Yeah, but they are coming down.
We can really if they are visiting their local dentist, giving them the information that what they need, what they don't need about fillings or something like this. We can do it with laser. We can do it without laser. We can do it whatever they like, and especially the implants, the ceramic implants, and the other type of implants. And I'm more than happy to discuss this over the phone or over the Zoom.
Or on a Zoom, to have a free consultation. Thank you, Boji.
Or WhatsApp meeting.
And also people watching this might think, does it hurt? And I would vouch. I mean, I am as I say, I've always been terrified of the dentist chair. It doesn't, you know. I mean, it actually doesn't hurt.
More gentle approach with the laser to treat the gum disease rather than just scraping down the roots. And taking the plaque outside,
and knowing that you're going to regenerate new tissue, new gums, new bones, and
it's
you're
a
not
big achievement, really.
It's
really worthy.
It is.
It's really worthy,
Is there? I know you wrote some notes before we sat down to have this chat. Is there anything that you wanted to say on a technical basis?
No, really. I'm really happy for this chat today with you, Karen, and really, I think we have gone through so many stuff through my email and the practice email. They can send me if you need to contact me. I am more than happy to answer your emails and questions.
Lovely.
With pleasure.
Lovely. Thank you, Boji.
It has
been a pleasure.
Thank you very much, Karen.
Thank you for saving my teeth.
Thank you. Thank you too. Thank you for being my patient.